everyone, you're welcome back to my channel. I'm Nurse Esther, the Nice Nurse Cares. If you're new here, I deliver contents on nursing and health, and to my returning subscribers, I say thank you. So today we'll be discussing Cushing syndrome. Without wasting much time, let's get started. Cushing syndrome is a metabolic disorder resulting from chronic and excessive production of cortisol by the adrenal cortex. Cortisol is also a type of hormone, a steroid hormone in the glucocorticoid class of hormone. Glucocorticoids are the hydrocortisones, which are stress hormone. Cortisol helps regulate blood pressure and blood sugar, reduce inflammation, and metabolize food. It is also a stress hormone. Cushing syndrome can also be caused by excessive dose of hydrocortisone for several weeks or longer. That is called an exogenous cause outside the body or iatrogenic cause. There are other ACTH producing tumors which can also cause Cushing syndrome. These tumors may be in the lungs, in the pancreas, or in the GI tract, the gastrointestinal tract. ACTH is a hormone that promotes the production of cortisol, and it is usually secreted in the anterior portion of the pituitary gland. We have just talked about Cushing syndrome. Now, we want to also talk about Cushing disease. So, Cushing's disease is a metabolic disorder characterized by abnormally increased secretion of cortisol. It is endogenous, caused by increased amounts of ACTH, adrenocorticotrophic hormone, secreted by the pituitary gland. The assessment: patients will have moon face and a buffalo hump and truncal obesity. There is generalized muscle weakness and muscle wastage. This is caused by hypokalemia or loss of body mass by increased catabolism. Remember, Cushing syndrome can also be called hypercortisolism. There is excessive production of cortisol. There is peptic ulcer. This is caused from increased gastric production and pepsin secretion and decreased gastric mucus. There is irritability, emotional lability, from euphoric behavior to depression or psychosis. There is hypertension. Hypertension occurs because of the retention of sodium and water. Compromised immune system can also result because of decreased lymphocyte production, decreased white blood cell production, and antibody formation, and this can make the client to be more susceptible to infection. There is hyperglycemia and hypocalcemia, which predisposes the client to osteoporosis. The skin is fragile and can easily bruise. The client has red purple striae on the abdomen and upper thigh. Nursing intervention: you monitor the vital signs including temperature, blood pressure, and heart rate, because a significant change in temperature may indicate infection. So any significant change in the vital signs may indicate the need for further evaluation and intervention. Patients with Cushing disease may have compromised immune function, making them more susceptible to infection. So nursing assessment must include monitoring for signs of infection such as fever, chills, increased white blood cell, and localized signs of infection. Early detection and prompt intervention can help prevent the spread of infection and reduce the risk of complications. Assess the patient's skin, because prolonged exposure to cortisol can lead to thinning of the skin, and the skin will become fragile, making them prone to skin injuries and poor wound healing. So regular skin assessment will help to identify any form of skin breakdown, pressure ulcers, or infection. So provide appropriate skin care. Keep the skin clean, well moisturized, using pressure relieving devices, and implementing preventive measures is crucial to prevent skin complications. Monitor fluid and electrolyte imbalances. Patients with Cushing disease are at risk for fluid retention, electrolyte imbalance such as hypokalemia and hypertension. Monitor the input and outputs. Daily weight. Monitor laboratory values can help detect fluid and electrolyte imbalances. Collaborating with other members of the healthcare team to implement appropriate fluid and electrolyte management is essential to maintain fluid balance and prevent complications. Provide patients psychosocial support, education, and counseling, because Cushing disease can have a significant impact on a patient's emotional well-being and body image due to physical changes and potential long-term complications. Providing psychosocial support, education, and counseling can help patients cope with the challenges. Promoting self-care strategies and addressing body image concerns and connecting patients with support groups or resources can contribute to their overall well-being. Prepare the client for radiation as prescribed if the condition results from a pituitary adenoma. Administer chemotherapeutic agent as prescribed for adrenal adenoma that are inoperable. Prepare the client for removal of pituitary tumor, that is hypophyseectomy, if the condition results from increased pituitary secretion of ACTH, adenocorticotrophic hormone. Prepare the client for adrenalectomy if the condition results from an adrenal tumor. Clients requiring lifelong glucocorticoid therapy should talk with their HCP to increase the dose of glucocorticoid during times of stress. Assess for and protect against postoperative thrombus formation because Cushing syndrome predisposes to thromboemboli. Allow the client to discuss feelings related to body appearance. Instruct the client about the need to wear a medic alert bracelet. Monitor blood glucose levels and assess the stool for blood because diabetic mellitus and peptic ulcer are common problems. Before the client is discharged home, instruct clients and family that they should not stop glucocorticoid abruptly without medical supervision because the syndrome could recur. So the patient should always have an adequate supply of glucocorticoid to avoid running out. Diet. Nurse, stress the need for dietary modifications to ensure adequate calcium without increasing the risk for hypertension, hyperglycemia, and weight gain. The client and family can be taught to monitor blood pressure at home and to also monitor blood glucose and to weigh daily. It should keep up with follow-up appointments. Thank you very much for watching. See you in my next video.